Start of summer promises beach trips, barbecues, and vacations, but for people with Alzheimer's and those who love them, June also means Alzheimer's and Brain Awareness Month. Worldwide, 55 million people have the disease or another form of dementia, which is the sixth leading cause of death for adults in the U.S. Here now to discuss what Alzheimer's is and the signs to look out for is Dr. Robert Vassar. He is the director of the Alzheimer's Disease Research Center at Northwestern University. Thanks for being here. So we've all heard of this disease. Many of us know people who have suffered from it. It is a really painful thing to experience for the patients and those who love them. What exactly is it?
Well, Alzheimer's disease is the most common form of dementia among the elderly. It's a progressive brain disorder that impairs memory and the activities of daily living, and age is the greatest risk factor for Alzheimer's. Alzheimer's starts with the accumulation of lesions in the brain called amyloid plaques, during which time the person may feel completely normal, but over time, other brain lesions begin to form called neurofibrillary tangles, which appear to cause brain cell death and eventual memory loss and dementia.
Okay, and I know it's more common among women than men. Do we know why, and how prevalent is it?
Well, both men and women can get Alzheimer's disease, and they are affected similarly in terms of symptoms, but the disorder is more prevalent in women, as you say. In fact, almost 2/3 of individuals with Alzheimer's disease are women. And the reason for this sex difference is unclear. It could be related to the fact that women generally live longer than men, and age is the greatest risk factor for Alzheimer's. However, there may be biological causes as well. For example, sex hormone differences between women and men.
So a lot still to learn about it, I know. What are the signs that we should be looking out for that may be indicators for our loved ones and even for ourselves?
Sure. So the major signs are memory loss that disrupts daily life, challenges in planning or solving problems, difficult in completing familiar tasks, confusion with time or place, new problems with words in speaking or writing, withdrawal from work or social activities, and changes in mood, personality, and behavior. And there are a few other ones. I suggest people go to the Alzheimer's Association website for further information.
Is there a time or an age when people should start kind of assessing themselves, even if they're not noticing, any of these symptoms that are out of the ordinary, or that they've slowly progressed and maybe they don't notice they're there?
Yeah, well, that's a very good question. I think the persons that are in your life that know you very well can probably see whether these signs are cropping up, maybe better than you can yourself. However, some people that are very self-aware might notice some subjective changes in their memory, in which case I would suggest that they go to their family physician and maybe get a referral to a neurologist to be tested.
And is there anything that can be done to prevent it or to at least slow the progression of it?
Well, that's a great question. Now, last year, a new drug called Aduhelm received accelerated approval by the FDA for Alzheimer's, but there were problems with the clinical trial, and Medicare will not pay for the drug, which is very expensive. Now, the good news is that there are several other similar drugs that are in clinical trials right now, and they may be approved over the next several years. But until then, the following lifestyle changes may help reduce the risk of developing Alzheimer's or slow its progression. Now, most importantly, one should try to reduce their cardiovascular disease risk factors. For example, treat high cholesterol, high blood pressure, and diabetes if you have them. Stop smoking, reduce obesity. And I think one of the most important lifestyle changes would be to increase your physical activity to at least 30 minutes of moderate intensity aerobic exercise per day, 5 days a week. Now, combining this with muscle strengthening work would be even better. Also, diet is important. Eat a heart-healthy diet. For example, the Mediterranean diet with more fish, plant-based foods, and less red meat and sugar. Education is protective, so go take a class at your local community college, if you like, increase your social and cognitive engagement. For example, play cards with friends or join a book club. Get your sleep. 7 to 8 hours a night are recommended, and that helps clear the amyloid plaques out of the brain. And finally, manage your stress levels, for example, through meditation.
All right, Dr. Vassar, thank you so much. Really important information and useful to so many people. Thank you.
You're very welcome. Thank you.
70 years.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.